emotions. But although pain may not be easy to bear, there's a reason for pain being there. It's critical to know, lest a cancer unbeknownst grow, pain signals a need for repair. You learned of children with congenital insensitivity to pain. They're unaware if they have fractures or sprains. These children are rare, but they need constant care, or their injuries will not be contained. The small fibers you learned are essential to establish a painful potential, but shake your hand or vibrate, and you may close the gate so that the pain is no longer sequential. Was this known to that student of pain? The Marquis de Sade was his name. His charisma, it gripped you as he smilingly whipped you, and the pain could just drive you insane. The good news is that there are myriad ways to control pain, which is perhaps why cutting the cord's on the wane. Find out what the morphine dose is, even consider hypnosis. Remember, pain's a complex product of the brain. In this regard, find a pregnant woman and ask her, is Lamaze merely a ploy to distract her? Or when labor pain is not perceived by the brain, are endorphins a relevant factor? Now, of course, endorphins, there are numerous classes. Some, reportedly, are as potent as grasses. So if you're in pain, just depend on your brain, because your endorphins are the true opiates of the masses. Thank you very much. Okay. Thank you for listening. I'll take questions. We have lots of time. Yes, sir. Oh, there's a very... Would a panel of pain specialists vote to bring Vioxx back? The answer is, I would think many of them would, with a huge black box warning saying, be careful. Look, we know that aspirin has a terrible side effect profile. It's just been approved. I think people think that it is a very good drug. A lot of patients like it, and the beauty of it, 1 pill a day. Which, when somebody is a 60, 65, 70-year-old, they have lots of problems, they got diabetes, they got this and that, and they got a bucket full of pills. Instead of having to take 4 ibuprofen every 4 hours, or 2 or whatever, they can take 1 pill in the morning. That's a huge advantage. It's idiosyncratic, patients like it, but of course you've got to put this very big caveat around it, and so as long as they're not going to potentially be sued, they might be willing, but as long as they might be sued, then they'll say no. But I think it's a good drug. Yes, sir. You're absolutely right. The point is that you said that we can be regulated by dose, and you're absolutely right, provided you can get enough of the dose to produce the effect, right? Because if you need to lower the dose in order to reduce the side effects, you may not get the effect. Remember I said the whole game here is big effect, little side effect. We call therapeutic window. If you can't get it big enough, you have a problem. Every drug will have side effects. It's inevitable. The best drugs will have fewer side effects, but everything in too high a dose will guarantee to have side effects. Yes, ma'am? There's very few side effects of deep brain stimulation. In the worst case, the worst that can happen, and there maybe are a couple of 5,000 patients where the electrode, and the odds are very small, hit a significant vessel, all right? And you could have a bleed, and you could die. So in the worst case, but you can die. There's a percentage of chance you'll die in any surgery from general anesthesia. Putting the electrode down doesn't do anything. Is it possible to have infection near the opening? Always. But that's the case with any surgical procedure. So you'd use the standard approaches. What we call the morbidity, in other words, the bad consequence, is really very low with this procedure. It's not just used for pain, by the way. Patients with Parkinson's that are stopped responding to say, DOPA will have lesions or stimulation of a different part of the brain to control tremor. It's the same procedure. And so electrical stimulators in the brain are not new, and the actual procedure is not a problem. Technically, it's not a big deal. Yes, sir. Okay, so the question is, this Newsweek article emphasized this notion of neuroplasticity and the idea that, in fact, the notion that the implication really is when someone has an injury, you want to get in there really quickly and block the pain immediately. And they're doing that now. They're talking about doing blocks right on the battlefield. Because remember, one of the big problems with Iraq, there are many, but the major problem is that the armor, to some extent, is actually a lot better than what we're reading. And what happens is people get injured, and while in Vietnam they died, now they end up with long-term injuries and long-term pain. Get in there and treat literally on the battlefield. The question was, so that's the idea that there's plasticity, there's